Understanding the silent threat, cardiovascular disease. Cardiovascular disease, often called heart disease, is a group of disorders affecting the heart and blood vessels. It's a leading cause of death worldwide. This disease disrupts the cardiovascular system's vital role in transporting oxygen and nutrients throughout the body. When the heart and blood vessels are compromised, it can lead to a range of serious health problems. Some of the most common types include coronary artery disease, heart attack, heart failure, and stroke. Decoding the types. A closer look at cardiovascular conditions. Coronary artery disease, or CAD, is the most prevalent type of heart disease. It occurs when plaque accumulates inside the coronary arteries, restricting blood flow and potentially leading to chest pain or a heart attack. Heart failure develops when the heart can't pump blood effectively enough to meet the body's needs, leading to fluid buildup and shortness of breath. Stroke occurs when blood flow to a part of the brain is interrupted, causing cell death and potential brain damage. Understanding these conditions is crucial for effective prevention, diagnosis, and treatment. Recognizing the warning signs, symptoms you shouldn't ignore. Recognizing the symptoms of cardiovascular disease is crucial for early detection and timely intervention. Chest pain or discomfort, often described as pressure or tightness, is a common symptom of coronary artery disease. Shortness of breath, particularly during exertion, can be a sign of heart failure. Sudden numbness or weakness in the face, arm, or leg, especially on one side, is a hallmark symptom of stroke. Other stroke symptoms include confusion, trouble speaking, dizziness, and severe headache. If you experience any of these symptoms, seek medical attention immediately. The silent culprit: understanding coronary artery disease. Coronary artery disease, or CAD, is the most common type of heart disease affecting millions worldwide. It develops when plaque builds up inside the coronary arteries, restricting blood flow and reducing the heart's oxygen supply. Factors like high cholesterol, high blood pressure, smoking, and diabetes contribute to plaque formation. Symptoms include chest pain, shortness of breath, and fatigue, especially during physical activity. If a piece of plaque breaks off, it can trigger a blood clot, causing a heart attack. Section 5. Diagnosis and assessment. Unmasking the silent threat. Diagnosing cardiovascular disease involves medical history review, physical examination, and diagnostic tests. Doctors check for signs like high blood pressure, abnormal heart rhythms, and fluid buildup. Tests like ECG, echocardiogram, and stress tests help evaluate heart function and identify blockages. Coronary angiography uses a special dye to visualize arteries and identify blockages. Early diagnosis is key to effective treatment and management. Section 6. Combating the disease, treatment options, and lifestyle changes. Treating cardiovascular disease depends on the specific type and severity of the condition. Lifestyle changes such as quitting smoking, eating a balanced diet, and exercising regularly are crucial. Medications like statins, antiplatelet drugs, beta blockers, and ACE inhibitors help manage symptoms and reduce risk factors. In some cases, surgical procedures may be necessary to improve blood flow or repair heart damage. Combining lifestyle changes with medical treatment can significantly improve outcomes. Section 7. Living with cardiovascular disease, prognosis, and daily impact. Living with cardiovascular disease involves making lifestyle changes and adhering to a treatment plan. Many people with cardiovascular disease lead full and active lives with proper management. Fatigue, shortness of breath, and chest pain can limit physical activity and daily tasks. The emotional toll can lead to anxiety, depression, and social isolation. Regular checkups, medication adherence, and lifestyle changes are essential for effective management. Section 8. A global health crisis. The far-reaching impact of cardiovascular disease. Cardiovascular disease is a leading cause of death worldwide, accounting for approximately 17.9 million deaths annually. The burden is particularly high in low and middle-income countries with limited access to healthcare. High rates of risk factors like high blood pressure, high cholesterol, and smoking contribute to the crisis. The economic impact is substantial, costing the global economy billions annually. Addressing this crisis requires raising awareness, improving healthcare access, promoting healthy lifestyles, and supporting research.